if I have a couple of minutes, I want to show you something here. Our hospital has been doing this for almost 4 years. We've been collecting data. We've done close to 400 radial case. We've published multiple times in ACC and TCT and other society and conferences. And our last publication that we published recently in last TCT in San Francisco, and basically we looked at iliac lesion that we tackled via radial access and compared them as propensity match to femoral access of the same type of lesions. So we had 138 patients, and this is a busy slide, but basically it was a retrospective. We looked at it from February 2020 to September 2022. And of course, all diagnostic cases were excluded. And we pulled all the data. If you see here, there's really no significant difference between the patient populations. They were very close to each other in terms of demographic features. And what the results showed that, of course, what we expected, the length of stay were shorter in the patient who underwent a transradial approach. There was no difference in procedure time. There's no difference in the volume of contrast. 3 cases we had to convert to transfemoral, either because of arterial spasm or requiring an alternative access, kind of to cross and snare and a pre-crossing device. And if you look at the difference, really in hospital, this is actually not supposed to be in hospital. Stroke was 1 case in the radial versus 0 in the femoral. They said it was actually 28 days after. Access site hematoma was similar. 30 days mortality was similar. But then you look at 1 year mortality, there was a higher mortality in the femoral access. Again, there was a trend to higher mortality. The question is that just because of the complexity of the patient, or I wouldn't have a good reason why the femoral access patient had a higher 1 year mortality. So as a conclusion from our trial, we think it's, the transradial approach is a viable, safe, and non-inferior alternative to transfemoral in treating patient with iliac disease. And as you mentioned before, it's all about patient selection and, having more and more experience with those cases.